First of all, I would like to ask you for your both permission to use this interview for educational purpose on the internet.
Yep.
Excellent. Now, tell me about your accident. You had an accident. When was it? And tell me a little about that.
It was a motorcycle accident, July 28th of 2015.
Pictures that you got right after the accident and after it was corrected, where you see that there's a very severe fracture here in the bone here. And this is, we counted before, this is 4, 5 in the T6, thoracic 6, and somewhat 7. And practically the correction was to stabilize your back. And as well, I'm going to ask you, how much function did you lose after the surgery or after the accident?
I lost pretty much from T6 down.
Every function.
Yeah.
Okay. But you and I, we saw each other long after that accident. What were your symptoms when you and I, we met each other?
I had a lot of pain in my back and in my chest area.
And how bad was the pain, 1 to 10?
The pain was like 7, 8.
7, 8, okay. Were there any other symptoms?
Well, it's hard to remember them because they're gone.
Yes, excellent. No, but you know, I think.
But I breathe better now.
Yeah.
And I can get a deeper breath.
The surgery just was 5 months ago, correct?
Right.
And I'm going to move on to the pictures now. What we did, we extended the surgery actually way below where you had the previous surgery. As you see here in the surgery that was done, the surgery was stopped at, this is 4, 5, 6, 7. Here we went all the way down from actually 8 and 9. We put bigger screws as well. We put what we call bicortical screws, screws that grab on the other side of the bone. And as well, you see that the angulation here is much more natural than the jackknifing that you see here in that location. And here, if we go up and down, I'm going to go again up and down, and we see that the screws are in the same place. But I think important about this surgery is what device that you see here. We call it a cage, what separates the bone. Here in that location, again, you see that, and you see that it's coming horizontally from the left side. This is the minimally invasive direct thoracic, the procedure that we developed here, where we go with a half-inch incision and insert that device here that separates the bone, and that is device actually what brought that what we call jackknife deformity, that opened up this space and straightened it up, as you see here. That is part of the solution, that by putting that device in, it separates the bone and correct that jackknifing here. That's why this curvature here is much more natural than it is in the other one. Now, you stayed in the hospital a few days, but...
Surgery Thursday afternoon, and Friday evening you came in to see me, and I was sitting at the table eating my dinner, and you said, Mr. Morgan, you don't look like somebody who just had major surgery on your back.
Take you for the symptoms to subside to a point that you're comfortable and can do basic activities. Obviously, we didn't gain any function in the leg with the motor function, because that was not the goal of the surgery.
No,
that damage was done long ago, but you know, we wanted to reduce your pain, straighten you up, improve your breathing. How long do you think it took you to get there?
I'd say 2 to 3 weeks, and
excellent.
After a month, I was completely off of the pain medication.
Okay, how long were you?
Painful.
Yeah, overall, do you think the surgery helped you?
Oh yeah.
Excellent, excellent. Thank you for the interview.